Hello and welcome to the Days of Learning podcast. I'm your host, David Nelson, and it is with great joy that I have my guest, Dr. Courtney Berry. Dr. Berry, welcome to the Days of Learning podcast.
Thank you very much. Pleasure to be here.
Awesome. Dr. Berry is an assistant professor of psychiatry and behavioral medicine at the Medical College of Wisconsin. She's also in the Department of Family and Community Medicine. Her doctorate degree is from the Chicago School of Professional Psychology, and her master's degree is from the Medical College of Wisconsin. Dr. Berry, it is great to have you on the podcast.
Thank you. Thank you. I'm very excited to do this.
You know, one of the things that I like to learn about is the people themselves, because everybody's got a story, and we love to highlight stories on the Days of Learning podcast. Tell us about your journey to this point in your career and your current position.
Okay. So my journey actually started when I was about 10 years old, if you could think back that far. I was in the hospital for a routine procedure. I think it was the appendix coming out, and there was a kid next to me, and this is pre-days where we had all the private rooms and you just had that curtain dividing the two. And there was I want to say maybe about a 7 or 8 year old child next to me. And I remember the doctor kind of walking right past me because I was the first room. And they walked over, and the doctor was being loud and said that the child had had cancer. Test came back as positive. And then the nurse will come in to kind of talk about next steps. And they left. And I remember that moment so vividly, and the feeling I had. I wasn't being diagnosed. A stranger, a child I've never met before, was next to me and was being diagnosed. And I felt the pain for that family. I could feel it. I became tearful. And I asked my mom, "Oh, what's going on?" And she said, "Oh, don't worry about it. He'll be okay." And so from that moment on, I knew I never wanted anything to happen like that. It stuck with me. And so as I kind of advanced in my career and degrees throughout college, I found psychology, and I became really interested in it. I became interested in behaviors and how behaviors can change and what makes a person do something or not do something. So then I went on to graduate school, and found that I could combine the two things I really enjoyed, health and psychology. And so when I was in graduate school, getting my doctorate degree, I took a lot of health psychology courses and ended up getting a specialization in health psychology. And I knew that that was something I wanted to do because of that moment when I was 10 years old. I wanted to be able to help those that were struggling with health concerns, with any type of health issue, and be there for them. Maybe not medically and be able to kind of answer all the problems, but be there as support. So that led me to getting my degree in health psychology. And I had a lot of clinical experience, and I knew I wanted a little bit more. Of course, I never stopped. I never stopped learning. So I wanted to learn more about how do we change things? How do we come up with answers? How do we learn about why something is happening the way it is? And so I didn't have much research experience because my degree was more of a clinically based rather than a research base. And I knew I still wanted to be somehow in health psychology. So I came across the fellowship for the Medical College of Wisconsin in the Department of Family and Community Medicine. Thought, this is like the trifecta. I have the clinical psychology. I have the integration with health, especially in primary care. And I have the opportunity to do research. How perfect is this? So I applied, completed my research fellowship, and then also during that time completed a secondary degree. Again, haven't stopped learning. and received my master's in clinical and translational science from the medical college, and then continued on my journey in academics because I realized I wanted to stay there. I wanted to be able to do research. I wanted to be able to teach. I felt teaching was really important to me. And that experience still stays with me, being able to teach providers. How can we have some of the psychology behind this? And how can I help you kind of be the best doctor you can be? So then stayed on board in the Department of Psychiatry, Behavioral Medicine, and Family and Community Medicine. And I've been here for the past almost 6 years. Wow. Yeah. So it's been a journey, but it's been a very purposeful journey. And it's been something that I've enjoyed every minute.
You know, I really appreciate that word purposeful. And I want to go back. I am so inclined when you have these sentinel and seminal moments. I'm always interested to know about them at a deeper level. And I've known you for a while now. So this is, you know, I'm learning something new as our audience is. Mm-hmm. As you look back to that moment when you were 10, what do you think happened to you that made you so connected to this child and family that was in pain?
So I think it was a couple of different things. It was the fact that I was in the bed next to them in the same room. And for all I know, it could have been me with them coming in. So it was a little bit of, I felt that connection to them because I was in the same hospital room as them. I was not going through the exact same thing that they were, but I was in the same area and I kind of felt that. The other thing is when I heard them crying, I just wanted to go and comfort them. It tugged at my heart so much because I knew what it was like to feel sad and I knew what had helped me feel better, any type of comfort, support. And I wanted to be able to give that to this family, but I couldn't. And that was hard. And so that made me kind of really become connected to them, is that I wanted to do something, but I couldn't, no matter how hard I tried. And looking back on that, I think that's where my psychology comes from, in that I want to be able to provide support. I may not be able to fix your problems. I'm not going to, say that I can, but I'm going to support you and I'm going to help you. I'm going to guide you kind of through this.
It's quite beautiful and amazing. Frankly, when I was 10, I think I was more worried about pickup baseball and not getting beat up by my older brother. Wait, this isn't about me. We'll put that aside. We often don't give credit to children for their perception, do we?
No.
Why do you think that is? I really, this is a little bit off script, but I'm curious about this from that perspective. I can remember some things when I was 3 or 4. Mm-hmm. Now you don't understand them. Mm-hmm. Just like as a 10-year-old can't comprehend what cancer is, but right. There is that idea of being empathic and being sympathetic to a situation when people are hurting. Why don't we give kids more credit than they're potentially due?
Well, that's an interesting point and question. I feel that we think that kids can just kind of say things and And we're always like, okay, yeah, that's great, appeasing them and encouraging them. And we forget how aware they are, because we may
Mm.
not necessarily be as aware or paying so much attention or, you know, so empathetic. And looking back at that experience, I remember my mom telling me, don't worry, it'll be okay. And I kind of see that now in the sense they're trying to say to the kid, don't worry, it's going to be okay. So we don't cause any feelings of sadness, of disruption, or uncomfortable feelings. And so, but the child may be very perceptive of that. They're feeling sad and, or something else is going on. What can I do? Or what can we do?
Are we doing a disservice to children by doing such a thing as might be said, don't worry, don't be concerned?
That's a twofold question. So, yes and no, I'm going to say. So, yes, in the
Okay.
sense that we want to protect them, we don't want them to worry unnecessarily and um, be afraid or have any type of fear about, oh, something is going on. Should I worry? And I always tell the patients that I work with, it's okay to feel your feelings. Feelings are absolutely normal. They're given to us for
Mhm.
a reason. And sometimes it's okay, to allow, to have others experience. And I would say the same thing for kids. It's okay to have kids kind of experience some feelings and kind of providing support on how to get through it. What can you do with them? I mean, there's so many great kid shows out there now. I've so many Daniel Tigers I've seen about if you're feeling angry, stomp your feet or roar. So, and I've had kids roar.
Mr.
So
Rogers was on something there.
he was absolutely. But I think it's okay to allow them to feel. And I think, and kind of this is where my psychology background comes into play. It's what are we doing with these feelings? Feelings are gonna be there. We all feel sadness, anger, anxiety, maybe to different levels, to different extents, at different periods of time. But it's what are we doing with them? I think that's the biggest thing to be kind of working with kids is what are you doing with your feelings? Like, are we yelling at each other and yelling at parents because we're angry? Or are we just taking some big deep breaths because, we're feeling sad and we're just getting through it? Um, but I think kind of allowing kids to kind of feel it and then highlight what are we going to do with those feelings?
Yeah, I can think of the families that I've worked with. And because I think parents, I think there's cycles of this where parents have never processed their own feelings, whether they were kids or young adults or even mature adults. And so they don't know how to deal with it. And so they don't know what to deal with it with their kids. So it perpetuates in saying, don't worry about that. It's a grown-up thing. Where what you're saying is the idea of feelings and sadness and anxiousness is a part of life.
The topic may be a grown up thing, but the feelings can be there. And that's what I tell everyone that I work with. I may not be in your shoes, and I'm not going to even pretend to be in your shoes. What I do know, what I can relate to is the worry, the sadness, the joy you feel. I share those same feelings. We all do in some level. And I can relate to that and then kind of be with you in that. So the topic may be completely different and maybe um, more appropriate for adults, but the feelings may still be the same.
And I want to say this to you, that moment when you were 10, and as it's carried through, there's a great deal of insight and wisdom that can be gained from those experiences. How has it stayed with you in all of these years?
It's motivated me. It's driven me and shaped kind of what I wanted to do with my career. In the sense, I wanted to be able to educate others regarding health and the importance of it and the psychology behind it as well. And the only thing that is, that is really poignant right now, I didn't want any other kid to experience what that must have felt like. To walk in, say it, walk out, and say someone will be in with you, kind of talk about next steps. Okay. And to kind of have someone else go through that. Because even though I didn't, that was something I didn't want to have others experience.
Thank you for sharing that with me. I want to honor that sharing and that caring, and both the joy and the burden that comes with caring with that.
Thank you.
Courtney, I want to ask you, there's a great deal, you said health, and you've been talking about health. Mm-hmm. And many times we think about health as, is my physical body whole? Mm-hmm. But we're really talking about not an either or, but something more. Mm-hmm. How do you look at health as a clinician, with your training, your background, your experiences?
So I look at health as a combination of mind, body, spirit, culture. There's a biopsychosocial approach, and in graduate school, we added on cultural and spiritual as well to kind of encompass the whole. And I look at it more from what can we be doing to get you to where you want to be in terms of your health. And I use health as a whole, whether that's physical, whether that's psychological, whether that's social. What can we be doing to get you to where you want to be?
There's a Hebrew word that goes with that called kafesh. Have you heard of that word?
No, I haven't.
It's a Hebrew word that comes from, it has a base in Christianity. Okay. And it speaks of, we are actually spiritual beings with a body. And this kafesh is that you can't separate the body, mind, spirit, culture. Okay. Is that how you look at health, that you can't separate the issues?
Yeah, I think they're all really, really connected. And that leads in, can lead into some of the work that I've been doing in relation to my research that I've been kind of working on throughout my time here at the medical college. And how, if we're, if one is kind of not where we want it to be, the others might also kind of not be where we don't want them to be as well. So how can we really work to kind of maybe address one area and then we can see kind of what happens to the others, as they are all connected.
There's a great deal of misunderstanding. And I trained as a counselor in the 90s, so a long time ago in some respects. And we still had this thing then where we were dealing with the stigma that comes with the psychological aspects of it. Well, I'm not crazy, right? Why do you think there's a great deal of misunderstanding about psychology and about the work that you do?
I think there's a lot of stigma still associated with it. And with the stigma comes the feelings of shame, guilt. I'm struggling with some areas in my life. I'm struggling with some things. I may not be, I can't work through it on my own, or I'm needing some additional support. I think it's also not knowing as well about what psychology actually is, and being able to it can just be a form of support. As I look at it, it's more of a process of guiding people toward making changes that speak to your values. What's important to you? What do you want to be known for? What do you want your life to look like? I want to be a awesome colleague. And so what steps do I need to take to get there? And maybe what might be in the way, and how can I deal with that? So it doesn't have to be anything, as people think about psychology and mental health, the typical things that come up are depression, anxiety, more of the psychiatric disorders. But how I look at it is just helping people get toward their values, towards where they want to be in life, and how can I help you make changes, even if it's something as small as, how can I be a better communicator? Awesome. Why is that important? Because I want to be a better colleague. Awesome. So let's get there.
Yeah, or I've been a verbal proponent of mental health counseling for as long as I've been in counseling, and I'm still in my fourth year of therapy. Love my counselor, Lisa. You said a couple of words that I want to tug on and I want to go into a little bit. I like that idea of guiding, and I do think of my counselor as someone that's guiding. And when somebody says, "Oh, what do you talk about?" This idea of shame and guilt is an underlying current of issues for many people. Where does this come from? Is this a cultural phenomenon, or is this a family phenomenon, or is it yes?
Could be both. Could be culturally not supposed to talk about kind of what happens outside of the four walls at home, or kind of what's happening within you. It could be a family that this is how people were brought up, and we figure out our problems, we work through it, and that's it.
Or we don't figure out our problems and we stay with it.
Correct.
Which is more likely the case.
Correct.
And there's fear with it, isn't there, with people who are just starting that process? Is that correct?
Yes. There can be fear associated with kind of stepping out into maybe something that may be uncomfortable. And that's, that can happen. Some people actually might be excited to kind of be able to finally, kind of talk about it. I found a great connection. Let's kind of open up and talk. But yeah, there may be some fear with kind of stepping out and, kind of sharing some of the personal experiences that may have happened to you with a complete stranger. It could be.
So how does it work?
So in terms of how does,
well, you said it's this idea of two strangers, and I'm supposed to share with you Things that scare me and things that worry me. Is that how this works?
No, you're not. No, you don't have to share anything. The beautiful thing that, and a thing that um, I kind of focus on is if there's some things that are kind of, you know, that you want to talk about, you're not ready, we'll talk about it when you're ready. This is about you kind of taking the lead in your life. And that's what I meant about the process of guiding patients. I'm not going to tell you, hey, I think we need to talk about some things. You check this box on this form. I think we need to talk about it. But it's more about what's important to you right now. How do you want to show up in life? And how do we help you get there? How can I guide you toward that? So that you are showing up the way you want to show up in life. Not how I want you to show up, not how anybody else in the world wants you to show up. It's how you want to.
So you're not making people do anything, right?
No, not at all.
Tell me, like, you don't have people lay on the couch, right? And tell me
No.
Tell me about your childhood.
No. Now we just sit.
You know, I want to go to a tough subject, and I want to have you talk about it from this perspective of guidance.
Okay.
We hear a lot about this idea of trauma in some of the areas that you research. Tell our audience what it is first off, and then we'll take that idea of how you guide people in that space.
Okay. So a trauma, and I go kind of based off the SAMHSA definition. It can be an event, series of events, different circumstances that a person experiences as either physically harmful, emotionally harmful, life-threatening, and the most important part is lasting adverse effects on their mental, physical, social, emotional, spiritual well-being. So all those areas, all of them, one of them, any of them. But I think the important part is that it can have the adverse effects. So when I think about trauma, it's a person might experience a traumatic event and may be able to deal with it and then kind of move on. But it's when it has lasting adverse effects. That's where we want to kind of intervene and address it.
Can you give us an example?
Yes. So as something can be traumatic. So the main categories, and this was developed in the original ACE study by PsyD out at Kaiser Permanente. They had looked at different forms of abuse in childhood. So, and then if a parent was incarcerated, had substance use. So again, these were specific events or a series of events that had happened that they had asked adults and to kind of look back on their childhood. And so those are the most classic examples of a trauma. But now we've expanded it to, events in adulthood, witnessing someone getting hurt, witnessing someone being killed, being in a motor vehicle accident. It can be traumatic for people, even being in a natural disaster with all the hurricanes or tornadoes or whatever it may be.
What would be the lasting impact from some of the things you talked about that go with children?
So in terms of children, so some of the things that could happen is, when there's a trauma, you can, it can cause the body to either fight, flight, or freeze. Thinking back to when we learned about that in school, the fight or flight response. And however, if that is continuously happening or if it has been impactful, the body can still react even in non-threatening situations. And the newest research coming out is showing that experiencing trauma in childhood can actually change the brain structure. So there's now big focus to kind of, how do we prevent this from happening, and how do we kind of intervene appropriately so there aren't long-term adverse effects that are popping up in adulthood.
So can it be a one-time event, or can it be normal? Is it repeated events or multiple things that can happen to an individual that makes them more likely to be impacted over the long haul?
So I always go back to kind of the standard. It can be one impactful event, or it can be a series. Because when we think about, if it's happened and the trauma then may induce the stress response, and and that's where the body produces more adrenaline, heart racing, etc. And so those that may experience a trauma may have that always, quote unquote, turned on. So I think about it kind of like a car engine that's always running, and the wear and tear that starts to happen on the car. It's the same thing kind of on the body. If that stress response is always happening, body never has a chance to kind of bring it down and kind of to be able to get back to baseline. And so that wear and tear is happening.
So for people that this has happened to them, how do they make the connection between something happened and something not being right?
What do you mean by that?
We're fortunate in that we have good medical care. We have we live and work in an environment that mental health is supported. But I've been in plenty of situations and communities where mental health is not supported, whether it be on access to care or the belief system, the stigma, the shame that goes with it.
Mm-hmm.
How do people make that connection who haven't had the exposure that we've had in our lifetimes?
Well, I think it's about kind of going back to having a conversation about, how do you want to show up, and maybe what's in the way of that. And so when talking about this, and talking about trauma and how maybe these things, and how people can kind of make the connection, it's about being able to identify something that happened but maybe is not currently happening to you, and how are we carrying that feeling, those thoughts, that experience with us, and how do we get it so it doesn't have to define our decisions. So the best analogy I can give, and the best example, it's like having a scar, right? We have a scar somewhere on us. the scar doesn't stop us from doing the things we love. It's just something there, and we acknowledge it as there, but we don't let it, oh, there's that scar. I can't do that. I can't talk to that person, whatever it may be. And so if we come back and we notice that scar, this is where we can kind of learn different tools to address some of the thoughts and feelings that may arise when we look at that scar. And we can kind of give some space for that, and then be able to kind of work on how do we kind of address that and still move in the direction we want without letting that scar direct us.
You know, you've been doing this for a while. Is it visible to you for someone who observed people for a living?
No. Nope. Not at all.
So that you really have to have some personal insight.
Some. And some of the things may be, hey, something's off. I don't know what it is, and that's okay. Figure it out together. That's part of it. That's part of the guiding part, is that I don't need you, to know exactly. It's okay. We'll do it together.
I was also thinking as you were speaking that the idea of having someone who could be a good friend to say, something's off. I don't know what to make of this. And the person says, hey, maybe you ought to go talk to someone about that.
Yep. That's awesome.
What happens when it's unaddressed? Let's go that way first.
When the trauma is unaddressed?
Yeah.
So fortunately and unfortunately, fortunately, we've been studying this, so we're kind of seeing what happens. Unfortunately, when the chronic stress and we have that chronic inflammation from the body, from that flight or fight, the car always running, I'm using that in quotes, that can lead to a variety of illnesses in adulthood, cardiovascular, autoimmune, and even the ACE study that was done has kind of shown the connection between cancer, COPD, etc., diabetes. And it's not just maybe the chronic stress and the inflammation. Here's my favorite part. It's what are we doing to kind of manage those thoughts and feelings, the emotions and stuff? What behaviors are we doing? So this is where it really piques an interest of mine is, how are we coping with this? Are we using food? Are we using substances? Are we just kind of shutting down and not doing anything about it? Are we smoking to kind of alleviate it? So that's the part too, where some of the chronic health conditions can be coming from, are the behaviors that we're doing to help alleviate the trauma.
So more than likely, it's going to show up in some way in the person's life. Yes?
If there are a lack of support, if the person may not be resilient, and that's the other area people are looking at. So not mostly on prevention, but how can we enhance the resiliency of people? What can we do to enhance the resiliency of kids, for instance, so that if they experience this, they have the support and this trauma may not affect them and then show up later on in life. So we're not only looking at trying to address what's going on in the moment, but how are we preventing traumas from happening? That's through the community work. And how can we foster a resiliency in people.
I'd like to prevent trauma from happening in the first place. That would be good. If you could work on that, we'll have you back.
I will add it to my to-do list.
I want to ask this now because it's this one of our sponsors, the Centers for Disease Control and Prevention, and this is a grant that's affiliated with prevention of chronic diseases like hypertension and diabetes. You mentioned cardiovascular health.
Mhm.
How does psychological aspects fit with chronic diseases? Can you speak into that?
So it's all about kind of going back to management. So when you were talking about chronic diseases, the first thing that literally popped into my head was slowing down that stress response, and simple as deep breathing. And it sounds so easy, but it can be so difficult just to sit and be able to take some deep breaths, just kind of bring yourself back. And so the psychology in this and how they kind of come together is being able to kind of help slow that stress response. What can we do when we're experiencing that stress? How can we slow it down? Whether that's mindfulness, which is, as you know, my ultimate favorite, love doing mindfulness, or even engage in activities that promote self-love, acceptance, etc. So all those things can kind of help reduce some of that chronic stress and the inflammation. And again, it's kind of also looking back at some of the other things like the behaviors, like what can you do that brings you joy. Whether that's drinking out of your favorite mug, which is what I always tell people is if you have a favorite mug and you have a favorite flavor of coffee or water, taking that time to kind of slow that chronic stress and that chronic stress response down.
What does it do for you when you slow it down? And I just noticed myself when I took a deep breath, it was like, oh, that's kind of cool. What happens?
So I think about it, and I'm going to go back to the car analogy because I love that analogy. The motor, it's turning the motor off, allowing that moment of, and it doesn't necessarily have to be relaxation, because when we talk about kind of being able to slow down, it's not be always running. So, and that might just look like rest. That might look like relaxation, but it's a felt moment. And I wish I could put words to that, but it's a moment where it's okay. I'm okay. I got this. And it brings you back to right here.
There's a calmness and a quietness that comes with it. Is that right?
Mm-hmm. Yep.
And even sometimes I want to say this because I felt it. I can do something very vigorous and very active where it's not rest. I get fidgety when I rest too long anyway, but then I get that calmness afterwards. Mm-hmm. Is it the same thing?
Mm-hmm. Yep. Where you do like exercise, and you get the same like a runner's high that they talk about.
Sure.
I'm not a marathon runner, so I don't know. But it's kind of that same feeling. It's what are some healthy ways we can do to get that same feeling? And when I teach providers, students, etc., I always we talk about so maybe the unhealthy, the smoking may provide some relaxation, but what's another thing that you can do that gives you that same feeling of relaxation? Taking a bath, hot shower, petting a dog. or whatever it may be.
You mentioned providers, and I want to go here now.
Mhm.
How do you encourage this type of effort to be brought into medicine? What would you say to providers, physicians, and people who do more of the body care to bring in the psychological aspects into their thoughts and practices?
So, in terms of addressing trauma or just in general?
Well, this idea of slowing down and the idea of the calmness that comes with being more aware of it, even deep breathing for that matter. Um, how can that be brought into medicine?
So, I don't like to add a lot to providers' plates because I know they do a lot. And I'm very mindful and respectful of that. But if there's certain things that maybe we can tweak to do a little bit differently, that may allow some more of that calmness, some more of that relaxation. And I'm not saying anything where I need 30 minutes of your time. I need you to sit in a comfortable spot. I need you to have relaxing music around you because I know that's not possible. But even if there's some things that you can be doing, a simple grounding technique to kind of bring you back right before you knock on the door, or when you're knocking on that patient door, what does that door feel like? Have you ever actually felt it? Is it smooth, or can you actually feel the grains? Small things like that can bring you back to kind of right here, right now, and bring on that sense of calmness and that sense of awareness. You know, that's what I teach providers. And I hope to instill it. It's nothing long, nothing long. The exercises that I'll give them for a mindfulness are usually about 30 seconds, if that, to do. And it's maybe something after a difficult conversation, let's regroup. Let's take that moment to get back in the present moment so that we can go on to the next patient.
Let's bring that into the encounter with the patient then. I went to see my physician once, and he had a medical student. I love medical students, and I love when they're learning. And the person was a third-year student, and they did all the systems checks, and they said, anything else? And I said, you missed a system. And they looked at me with horror in their eyes. And I could see him
mean.
checking.
That's mean.
It wasn't mean. It was very, I was being in the teaching moment. And I could see them going, I listened to his heart. I looked in his ears. I looked in his nose. And she said, what did I miss? And he says, you didn't ask me about my mental health. And I could see her go, oh my gosh, I forgot, or maybe it was repression. That's another conversation.
Yeah, it's a different topic.
I have said, and she was wonderful, and she just said, "Oh my gosh, I'm so sorry." I says, "It's okay. This is why you're learning." And I told her provider, that her preceptor, that she did a wonderful job, and she'll never forget this again. But I have had experienced providers that have been fearful about asking about it. How do we do better with that? If it's this integrated thing that you're talking about, this issue, that you can't separate it.
Well, we educate. We educate. We educate. We educate. And it's, like I said, it's not about having you do more. It's simply about tweaking. How are we doing things? And how can we just adjust a certain part of a history that we're taking to tie this all in? Um, you know, and I go back to, you know, to trauma and trauma-informed care, which is all about educating others on how to approach people who are struggling with trauma or who have experienced it, and we may not even know they experience it. But the best example that I give to the providers is, you know, when you go and you're about to listen to someone's heart, do you ever ask them, hey, can I put the stethoscope on your chest to listen to your heart? Do you ever give them that permission? And it's not changing anything that you're doing. It's just tweaking a small thing to be more informed and to be able to kind of provide that integration that, hey, I don't know. I don't know if you've experienced anything or what you may have experienced, but I'm treating all my patients like this, simply asking.
That was really quite nice. Thank you for sharing that.
Well,
You know, I'm a big believer in connecting outside of the clinic. And how do we do better about connecting health, as you're describing it, to the community? What might be some strategies that we do as a system? Um, yeah.
so I think some important strategies are one would be just educating and giving knowledge about this, because it's going to look like many different things. And you know, I wish I had a clear way, if someone's experiencing it, this is how it's going to show up, but it's going to show up in many different ways. And you know, to talk about more of the integration pieces, you know, to be able to kind of bring some of this more out into the community, and you know, kind of, because again, it's not just about the bio, psycho, social, tie in the spiritual, cultural aspect. So how can we also bring some of the community and what they know, and to kind of inform and to kind of help with what we're doing, you know, in terms of, you know, like the mental health aspect and so forth, and how do we provide care? And you know, maybe that doesn't happen within four walls, maybe it happens outside of, you know, and it's just a space for healing. But you know, it, it's a group effort, because we all bring something unique. And I think when we all bring that, the puzzle comes together. It's like, oh, that's
As
how
you
we
were
do it.
saying, absolutely, the word intentional was coming to mind. Do you
Mhm.
see it as needing to be intentional by all those that are engaged, whether it be the patient or the client and the provider, and the resources that might be available to both?
Yes, yeah, it feels intentional, like we all want to come together and be able to bring each piece to really promote health. Let me use that again. Health, in quotes, as within the community.
Dr. Berry, I can imagine that this can be painful for those that do this type of work, um, taxing in a way. Um, how do you stay healthy amidst the trauma and the turmoil? What are some of your rhythms and some of your practices that you work on for yourself?
So I do a lot of what I tell others to do. Um, I do a lot of mindfulness. I love mindfulness. And I know I do a lot of different forms of it, whether that's mindful walking. When I go and take a walk, I just listen for sounds, or I just notice kind of what's around me in the leaves. When I as my family will get frustrated when I listen to music. I don't listen to the lyrics. I pick an instrument and see if I can follow it all the way through. So there's many different forms. I also utilize support when I need it.
Wait.
What I miss?
Wait.
What I miss?
Wait. You do what with the music? Go back. How's that work?
It's mindfulness. When you pick a song and you maybe don't listen to the lyrics, because you know you can automatically just kind of, you can be doing something else and you can be singing along with it and you're maybe not paying attention.
I do 4 things when I listen to music.
So it's actually, you pick an instrument and you see if you can follow it all the way through, and you can kind of notice when it comes out, what does it sound like, or starts up again? Is it loud? Is it soft? What's the tone of it? It's fun. It's frustrating. It's fun.
Okay. It's intentional.
It is. It is. It is.
Go on. What else do you do? This is quite interesting. And I want to go there because okay, I just interrupted you. Tell us some more of your practices because I have a follow-up question.
Okay. I go to support when I need it. I always will talk to, and I make it purposeful or intentional to talk to others about kind of what's going on. And, when I talk to sometimes colleagues or sometimes just friends, I don't talk about work or what's going on professionally. I just talk about personal stuff and enjoy that time and want to hear about them and, kind of share their joy in things as well. What else do I do? I like to read. And again, you're going to find this a little interesting, but I like the actual book because I like to feel the book. And to feel, because if you notice, there are some books that pages don't necessarily all align when you close it. There may be jagged or overlapping. So I pay attention.
That is fascinating. So I want to have you speak into this mindfulness things. Is it stuff? Okay, it's mindfulness stuff.
Yeah.
How does someone begin to becoming more mindful or intentional about their life? Give us some practices that people can do.
If you know your 5 senses, you can become mindful. Simple
Hmm.
as that. I don't like to make it any more complex than that, because when we get complex, then it gets into, I don't have the time, or it's too hard, or I can't focus. It's simply, if just about noticing things around you, maybe paying attention to some of the details that you may not have noticed before. It like, especially when we're outside, noticing kind of, what does the ground feel like? Is it squishy? Yes, I just used the word squishy. Is it firm? Do you hear the leaves crunching at this point?
I think we need more squishiness in our lives. I'm going to be honest.
Okay.
I miss the squishiness. I miss hugs. Hugs are squishy.
Yep.
Hugs are squishy.
Yep. But it's all about using your 5 senses and kind of bringing yourself back to the present moment on purpose. And
so for someone just starting out who expects perfection, which is one of those things that we have to be wary of, how do you tell people to begin this? Who wants to be perfect right away? Raise your hand. Oh, that would be me. No. Yes, that would be me.
if you can do it for 3 seconds, awesome. We'll get you there. It takes time. And it's just about practicing. And I know, it's kind of like, just being able to really bring it back to right here, right now. Because the more we can kind of practice, the easier it gets when we need it. That's what I tell everyone. I always will say, don't do it when you're upset or there's something going on and that stressor. Oh yeah, what did she tell me to do? There was something. Do it when you're calm and you're relaxed and you're just sitting, you're watching TV. And and you have your hand on the chair. What? No.
Gritting my teeth isn't one of them, right?
No. And you have your hand on the chair. Maybe describe that sensation. Like, what is it? Oh, this is lumpy.
Oh, now I'm doing it.
See, that's it. That's purposeful. That's bringing your attention to it. But it shifts you from whatever you're kind of thinking about, what you're going.
In all seriousness, and I wanted to ask you about this as we start to wind down today.
Mm-hmm.
I think we all crave that idea of the slowing down, the idea of having a relationship in our life that we can just be ourselves. What do you think of that?
I think that wanting to slow down, yes, I agree with, and being able to bring yourself back here, or right here, right now. But I think that can then help you do a quick, a navigation check-in. Am I going where I want to be? The answer is yes. Hey, keep going. Rock on. I will be holding the signs and cheerleading you and break out the pom-poms to support you. And then if on the other hand, it's like, no, I'm really not. Okay. Rock on. First being able to know that and see that. And what can we do? Can get you to where you want to be? How can we help with that? But I think that slowing down may help us realize, hey, whoa, this is taking a lot of my attention. That's not how I want it to be.
Yeah, I can say to you that I'm feeling slower just being around you. You are a joy. I love being around you and talking with you.
Thank you.
Anything else you want to tell us at this time?
No, I think the one thing that I'd just like to convey is knowing that there are, that psychology and resources are available and so forth. And there's always, being able to connect. And it's remembering that this is a process. This is a journey. This is not a marathon or sprint. I'm sorry. I'm not a runner at all. So I always get my little running metaphors mixed up. This is a marathon, not a sprint. But the marathon doesn't have to be done alone. You can have whoever you want join in with you. You can have any type of support. You can ask for water at any point. You can ask for a break. Okay. And that if we can all kind of run the marathon together, I think our community will be in much better shape.
Maybe a metaphor is a journey. Marathons have beginnings and ends.
That's true. I always forget about that.
This is a lifelong process, not one that you just do and are done with, but there's discovery that happens at every step of life.
Mm-hmm. Yep, there is. And that's cool.
It's awesome. I'm going to ask you, Dr. Berry, will you come back again? And maybe we can do some of, I think our audience, I love this idea of practicing of mindfulness. and maybe we can have a show and we'll bring a couple people and we'll do some practicing together. How does that sound to you? And love to hear more about some of your research as well.
Sounds great. I'd love to do it.
You
Happy
are an
to.
awesome individual.
Thank you.
If people want to get a hold of you for either consultation or any other things that they might want to talk about, how do they get a hold of you?
They can always send me an email. Now that we're remote, I don't really have the office phone, but you can always send me an email. Do you want me to say it? Are you going to post it?
Yeah, go ahead and say that email so people can get a hold of you if they want to.
Sure. It's cobarry@mcw.edu. Feel free to send me an email if you want to reach out.
All right, Dr. Barry, give us a mindful tip before we sign off. Give everybody one last tip for those who stayed with it the whole time.
A mindful tip?
Yeah. Maybe give me a mindful tip then.
Okay. So mindfulness is as easy as taking a deep breath. So we all breathe. Why don't we do one right now?
All right. Wonderful.
Thank you.
Courtney Barry, you are a wonderful individual. We thank you for being on the Days of Learning podcast.
Thank you.
Until next time, I'm your host, David Nelson. Thank you, Dr. Barry.
Thank you.
What a wonderful interview that was with Courtney Barry. I really appreciate how she brought that experience as a child to bear into her career. How wanting to give comfort to a child that was dealing with cancer was something that could impact you later on. I think it shows the importance of compassion, the compassion for children, but also the lasting impact of those things that come into our lives. She talked about this idea of the biology, the psychology, the sociology or the social aspects, and even the spiritual and cultural aspects of life. And it's hard to separate one from the other. And then how if we have this idea of being mindful about our lives, using our five senses, that somehow we can slow ourselves down and maybe impact some of the things that are happening in our community around chronic illness like diabetes and hypertension. Oh, I look forward to her coming back to show us about what we can do to be more intentional and mindful. Well, that's another show, and we want to thank our sponsors, the Medical College of Wisconsin, the Centers for Disease Control and Prevention, Wisconsin Department of Health, and Milwaukee County Organizations Promoting Prevention. I'm your host, David Nelson, and this is Days of Learning Podcast. Have a wonderful day and continued health and wellness to you and yours.